All right, there's January, February, March, April, May. Let's see about there, and then they'll be gone, things like that. There's so much to plan. Hi, I'm Ginger Bratzel, New Patient Attraction Automation and Mobile Marketing for Dentists, and we're talking about marketing and when to be marketing. Now, I've done videos, I've done articles on marketing calendars. You can go back and reference those for general information about that topic. But we're going to dive in on some specifics and things that you need to be looking for. And there's certain trends and certain niches that have certain marketing times, and be able to apply that to your calendar. So let me give you some examples. Let's say it's the end of the year and you wanted to be marketing for patients to come in and get the preventive treatments done, use their $1,000 max, which most insurances have before the year, and use it or lose it. You need to be proactive and be planning on doing marketing in October, November, and December to make sure they get in by the end of the year to happen. That is a time appropriate marketing, because once January 1st happens, that's no longer valid, and they lose that benefit and you lose that opportunity for your practice for services they needed anyway. So make sure you're planning on it. And when you do your marketing, make sure you plan enough time to get it done. Again, there's plenty of videos on it. I've done several on them. Go back and reference those on anything to do marketing calendar and scheduling for your marketing. Now, another thing I really want you to start thinking about is marketing per niches. There's certain times of the year, certain niches and certain procedures are more inclined. Now, you can look in your own practice and you should do it, but let's just go through, class reunions, summer times, weddings are more cosmetic oriented. They have a deadline, and those happen a lot in those time periods, so people are looking for more of those services. So you need to be having enough time to complete it for that June wedding. If you're going to need 6 weeks to do treatment, you need to be marketing and 2 to 3 months before that 6 weeks to make sure you get everyone in there. So if you have a calendar, you're planning that in advance. Marketing just doesn't happen by accident, not successfully anyway. Now, like I work with doctors all over the country. So for instance, I have doctors who are in the Chicago area. It gets very cold in winter. They have a lot of retirees. They're catered to their niche. They go to Florida and they're snowbirds. So as far as their implant marketing, we could probably slow that down in November, December, January, and start ramping it up in February. Now, it doesn't mean we're stopping all marketing altogether. We're going to work on other marketing avenues during that time. We're going to be pushing them for doing that, and they're going to rest their implant. But when February comes, February, March, April, they're not going to be doubling or even tripling it. They need to be really booming out their implant marketing because all their snowbirds are coming back. Now, conversely, if you're in Florida and you only have the snowbirds for a certain amount of time, you need to get them as soon as they hit. So your marketing needs to be hitting in September, October, November to hit the snowbirds as soon as they touch the ground, and be able to get their treatment done before they head back up to Chicago for the cooler months come the summertime. Now, do you see how that happens? It's not by accident, it's by planning. So when you're marketing for patients to get in for their insurance end of the year, you want to use insurance to drive them in. You don't want to use insurance as an excuse. It's a reason. And also when you work on incentivizing people to come in for December treatment when they're in Florida, or April treatment when they're in Chicago, you need to incentivize and use that as a reason for it. So, well, since you're back and from the winter and you're back to celebrate Chicago, let's get your treatment done. Since you're here for the winter, let's go ahead and get that done. That's in your marketing message, just talking to them. So use it as a motivator, not as an excuse, and put that on your marketing calendar. So there's Marketing Calendar 101 we've talked about, there's 2.2, and this is like high-tech stuff. This is advanced stuff I shared with you. I hope you found a lot of value in it. I hope you got a lot of insight out of it. Please share it with your friends or colleagues who could get use out of that too. Just email it to them, post it on Facebook, Twitter. You have my permission to do it, and share this information. Don't go yet. Not quite yet. I have just one more thing I want to share with you, and I need to include this in here. I get this question a lot, so I wanted to address it. I get calls and emails that come into our office with doctors asking about getting patients, growing their practicing, and they want to know how to do it. They want some steps by steps. They want more details. They want things like that, and I totally understand it. That is a wonderful question, valid point, and it is very, very laser focused and spot on. That's the question to be asking. So, simply put, if you are a dentist who wants to attract all the patients you ever could want or need for your practice, then you and I need to talk. Just email me at this address. It goes right to my office. Just personally send it off to me, and we will set up a time for you and I to chat over the phone and find those opportunities for you to achieve what you want to achieve, to hit your goals and to make things happen that you want to happen. So you need to call. You need to email me, and we need to talk. That's the gist of it. So I look forward to talking to you really soon. And for now, this is all. Goodbye. Talk to you really soon.